afternoon and welcome to today's COVID-19 update. I'm Heather Fairbairn and I'll be your moderator today. Before we begin, allow me to introduce Premier-designate Mr. Tim Houston and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Take it away, Mr. Houston.
Thank you, Heather. Good afternoon, everyone. Thank you for joining us. I can't tell you how pleased I am to be sitting here today with Dr. Strang. I have to say I saw a cartoon that said, "Oh great, now Dr. Strang has to train his third co-star inside 1 year." So, I'm happy to be here with you. I will say one thing that was very clear campaigning around the province is that Nova Scotians are overwhelmingly proud of our COVID response. Like everyone, we're all exhausted by COVID. But Nova Scotians are very proud of our efforts to date, and I know I've said this to you already, privately, Dr. Strang, but it's worth saying again. Thank you and the entire team at Public Health. We appreciate the work you've done to keep Nova Scotians safe. And continuing to keep Nova Scotians safe during what we hope are the final phases of this pandemic is a priority for my government. So to all Nova Scotians, during the campaign, I was clear that your new government would work with Dr. Strang and his team at Public Health to make common sense decisions focused on keeping Nova Scotians safe, and I meant it. I've had some good conversations with Dr. Strang over the past few days about the pandemic, and in fact we started those conversations the morning after the election. So Dr. Strang and his team are keeping a close eye on COVID-19 activity in the province, and Dr. Strang will talk in more detail today about what he's seeing, but most cases that we're seeing in this province are related to travel. With the Delta variant causing rising cases in other provinces, we must continue to be vigilant while we turn our attention towards a further reopening of our province. So as we do, we'll continue to follow the advice of public health experts. Of course, vaccination is the best protection against COVID, and I applaud Nova Scotians who have received their first dose, their first shot, and the 70% of Nova Scotians who are now fully vaccinated. But there are still 100,000-ish Nova Scotians who could get vaccinated but have not yet taken that step. So I want to remind them that to get to phase 5, where we will really begin to live with COVID, we need to have at least 75% of Nova Scotians fully vaccinated, along with low COVID activity. So to reach this target more quickly, we are asking Nova Scotians who have had their first dose to get their second dose as soon as possible. We're also asking Nova Scotians who have not yet gotten their first dose to take that step, to protect themselves, to protect their family, to protect others. Right now, we expect to be at almost 72% fully vaccinated by the end of August, and Dr. Strang has confidence that we can meet our 75% target by the middle of September, or maybe even sooner. That's why today we're setting September 15th as the target date to move to phase 5. This date is based on the projected timeline to hit that goal of 75% of the population fully vaccinated. If we hit the target sooner, we'll work with public health to change the date accordingly. But we want to give Nova Scotians a sense of where we are and what the plan is so that they can begin to plan themselves. I know everyone is asking, what does phase 5 mean? Quite simply, it means no restrictions or mandatory public health measures, and that's something that I know most of us are really looking forward to. We'll continue to have appropriate border measures and isolation for travelers who are not fully vaccinated, because with most of the cases related to travel, continuing to protect our borders is key to limiting the spread of COVID in Nova Scotia. So to that end, given the situation in New Brunswick and the connection to new cases here at home, Dr. Strang is today recommending we reestablish border measures with New Brunswick. If you're fully vaccinated, these restrictions will not apply to you. However, if you're not, they will. And they are that Nova Scotians and New Brunswickers who are not fully vaccinated but are traveling will have to quarantine on re-entry or entry into Nova Scotia. And that will be a week of quarantine and testing if you've had 1 dose, and 2 weeks if you've not had any vaccine at all. We expect this to impact a very small number of people, and an even smaller number of people when you consider that there will be protocols in place for healthcare and other workers, for students, for quick drop-offs and quick ups, ins and outs, to name just a few. The reality is being cautious has kept this province safe, and we will continue to be cautious. Part of life returning to some semblance of normal means a return to school. So with just a few weeks left for summer vacation for students, sorry guys, just a few weeks left though, we're also announcing today the back to school plan. School starts for students on September 7th. Since we likely will not be in phase 5 by then, masking will still be required in schools for the time being. We will reassess that requirement for phase 5 and transition to voluntary use of masks in our schools as we get closer. But beyond masking, back to school should look very familiar for students, teachers, and staff. Following the advice of Dr. Strang and his team at Public Health, schools will return to a more normal routine. Key lessons learned, like more enhanced cleaning, will of course continue. But I'll turn it over to Dr. Strang to provide more details and context of both phase 5 and the upcoming school year. Dr. Strang.
Thank you, and good afternoon, everybody. And first, I'd like to congratulate and welcome you, Premier-designate. Today, we are talking about how things are likely to look in September. The 4th wave has arrived in many parts of the world, and case numbers are rising even in Canada. Right now, our case numbers are manageable. There's no sign of community spread, and most of our cases are related to travel or close contacts of previous cases. But it's only a matter of time before the 4th wave is here in Nova Scotia too. We should expect to see increasing case numbers and even localized outbreaks, largely in unvaccinated groups. The key to getting through the 4th wave is vaccine, and I can't say that strongly enough. The more vaccinated we are, the less impact a 4th wave will have on people, our healthcare system, and our economy. We are in good shape, but we aren't where we need to be yet. About 70% of Nova Scotians are fully vaccinated, and we are leading the country with our vaccination rates. And I'm proud, as you should be, of the work Nova Scotians have done to protect one another. Our target to move into phase 5 is 75% of all Nova Scotians with 2 doses of vaccine. We had hoped to reach that by the end of August. Now we expect to be at 72% by then, which is close but not close enough. We need everyone who had their first dose to get their second dose as soon as possible. And if that is you, if you're waiting for your second dose, please do not wait. Move up your appointment, get your second dose now. Every 10,000 people who does moves us 1 percentage point closer to our target. And I also want to reiterate that it's never too late to get your first dose. The Premier-designate noted that there were 100,000 people who could get vaccine but haven't yet received vaccine. Now is the time, if not to protect your own health, then to protect those who can't get vaccinated, like children under 12. And I do want to mention 2 key issues related to vaccines: additional doses and vaccine mandates or policies. Some jurisdictions have decided to provide 3rd doses of vaccine for people who are immune compromised. The National Advisory Committee on Immunization, our expert group in Canada, is looking at this issue and will make a recommendation in September. They are the experts, and we will wait to hear from them. There's also been a lot of talk about vaccine policies. Some organizations are requiring employees to be fully vaccinated, and some governments are granting access to certain services and activities based on vaccination status. Throughout this pandemic, Nova Scotians have done what is needed to protect themselves and others, whether it's keeping your distance, wearing your mask, or getting vaccine. We are hoping Nova Scotians will continue to keep doing the right thing. If you can get vaccinated, please do it. It's safe and effective and will protect you and those around you. Your choice about vaccination needs to balance a right to choose with an equal responsibility to protect those around you. So we are watching our vaccine rates and epidemiology closely, and will bring forward recommendations on vaccine policy if we feel that is what is needed to keep Nova Scotians safe. As the Premier noted, we are now targeting September 15th for the final phase of our reopening plan. By then, we expect to meet our 75% two-dose target, so we can start living without restrictions and without mandatory measures. While our border policy will likely remain in place through the fall, most other restrictions, like gathering limits, masks, and physical distancing, will be lifted. We will continue to require self-isolation and testing for those entering Nova Scotia who are not fully vaccinated. The policy will not change for travelers coming from provinces and territories outside of Atlantic Canada. And starting August 25th at 8 a.m., we're also expanding it to include New Brunswick. New Brunswick has seen a recent rise in cases, and some of our cases in the last week are directly linked to that province. I know many Nova Scotians and New Brunswickers frequently travel back and forth. You should not be impacted by these changes, as we will have the same protocols in place for these circumstances that we have had previously. So really, this is about a small percentage of people who are traveling for recreation or leisure and are not yet vaccinated. But by being cautious and acting quickly, this is what has kept us safe throughout the pandemic. And to people who are concerned about this measure, if you don't want to have to self-isolate after traveling, now is the time to get fully vaccinated. And the only restrictions that will remain in place for Nova Scotia are those around managing COVID-19 cases. We will still test, track, and trace COVID-19 cases. We will still offer symptomatic testing and ask people to isolate while they wait for test results, even if vaccinated. If you test positive, you'll need to quarantine and follow public health direction. High vaccination rates and low case numbers means we won't need to focus on general asymptomatic testing, so we will begin eliminating that option. It will still be available to incoming travelers who need it, and to close contacts of confirmed cases and anyone else who is directed by public health to get tested. And we will also continue to use rapid testing for screening and surveillance at workplaces throughout the province. But things like masking, physical distancing, and gathering limits will no longer be necessary. And I'm sure there are mixed views on this. Some will be thrilled to get rid of masks, and others will be nervous to stop wearing them. And that's totally normal. It's time to start living more with COVID. Even if we see rising case numbers that would have previously meant province-wide restrictions, our vaccine coverage means that we can carry on with only border restrictions and maybe, if necessary, targeted local restrictions. But we also need to keep practicing the good habits that help reduce the spread of COVID-19 and, quite frankly, will also help reduce the spread of influenza and a range of other organisms that cause other respiratory and other gastrointestinal illnesses. So staying home when you're sick, washing your hands regularly, coughing and sneezing into your elbow, and regularly cleaning high-touch surfaces are important whether restrictions are in place or not. And as I said, they'll also protect us from a range of other viruses and bacteria. Even though masks won't be mandatory in most places, we still strongly recommend that you keep wearing them in indoor public places, especially as we move into the fall and winter. And let me just touch briefly now on the school reopening plan. It is based on public health guidance from my team and lines up with the direction we're going in general as we enter phase 5. Students, teachers, and staff have had two difficult years. This year should be easier. The school routine will look almost normal. And when we move into phase 5, masking will become voluntary for schools as well. With our vaccination rates and current epidemiology, I'm comfortable with the plan put forward by the Department of Education and Early Childhood Development. As the Premier said, if we keep our communities safe, our schools will be safe. We need to balance the risk of COVID-19 with the impact COVID has had on young Nova Scotians. In-person schooling is vital for a child and youth development. We need school to be as familiar as possible while keeping staff and students as safe as possible. The back-to-school plan sees a return to all school activities like sports, band, music, food programs, and clubs. Visitors will be allowed into schools following core public health measures, and school gyms will be open to community use after hours. If there is a case of COVID in a school, family, staff, and close contacts will be notified, but people should expect schools to stay open. If there are rising case numbers in a school or community, then we'll act quickly to put measures in place in that school or in that community to control things. But our goal will continue to be to keep schools operating and open as normally as possible. COVID-19 has started to move from a pandemic to a more regular part of our lives. But we need to begin to live with COVID. And to do that, we need enough Nova Scotians to get fully vaccinated. When that happens is ultimately up to us. So please get vaccinated, especially people who are aged 12 to 35. And keep practicing the healthy habits that have helped keep us safe. Wear a mask even when you don't have to. Indoor places when you're around other people. Wash your hands and stay home when you're sick. Heather.
Before we begin the Q&A part, I'm hearing that we're having a little glitch with our Wi-Fi, our live feed. So if you're using our Wi-Fi in the room, if you're able to get off it, we'd appreciate that. Thanks so much. We are going to open it up for questions from media in the room and on the telephone lines. For those on the phones that may have not heard earlier, we are introducing a new format today. So we're going to open it up to the room for questions for about 20 minutes, then I will turn it over. I will check in on the phones, and we have quite a few outlets on the phone, so I'll call you out by name for one question, we'll go through the list, and then we'll turn for a second time if there's time to do so, and then return to the room for final questions. All right, so we'll open it up to questions in the room. Go ahead, please.
Mr. Houston, congratulations. Yes. Well, last time New Brunswick was singled out, we had an issue at the border. I'm wondering whether you have talked to Premier Higgs, and whether, and I'll ask Dr. Strang to also comment on this, and whether both provinces are on the same page with what it is Nova Scotia is proposing.
Yep, absolutely on the same page. Have been in contact with Premier Higgs' office, and you know, I don't want people to lose sight of the fact that these restrictions are for unvaccinated people. So that's a cohort of people. It's not for everyone. Those that are fully vaccinated, it's business as usual. But for those that are unvaccinated, there's restrictions, and you know, both provinces are on the same page around those restrictions.
Yeah, I've also contacted Dr. Russell. We're both working to think what are the things in place that are going to support and encourage people in both our provinces to get vaccinated. So. That if they're in the category, that's not one of the exempt. Not like other provinces now. They're west of Atlantic Canada. If they're going to travel, they'll have to go to our Safe Arrival online, upload their proof of vaccination, and that's what's been in place since July for all the other non-Atlantic provinces.
Mr. Houston, a couple of back-to-school questions. What consideration, if any, was given to following New Brunswick's model where teachers are either required to be vaccinated or failing that, be subject to regular testing?
It's not something, I mean, there is discussion around overall vaccine policy. For that would be for schools, that would be for other institutions as well. But right now, at this point in time, and Dr. Strang can add to this, but with our epidemiology in this province, with our vaccination rates in this province, and our history, schools have been safe in this province through the whole pandemic. So I think when you factor in those things, I think that I had great comfort in the plan that I saw.
Post-secondary institutions are moving forward with mandatory vaccinations. For parents who are concerned that teachers aren't mandated to be vaccinated, especially given that children under 12 may still be at risk because they can't get vaccinated, what do you say to those concerns that are being brought forth by parents?
Well, I say first off, I mean, at least until we get to phase 5, which is probably a couple weeks away, there will be masking and other you know, the cleaning, the advanced cleaning criteria is still in place. So I think overall, when you look at, we can't lose sight of our overall vaccination rate in this province. I mean, that's an important thing. We're at somewhere in the range of 72% right now, fully vaccinated. When we get to phase 5, it'll be 75% fully vaccinated. That's you know, compared to other jurisdictions that are instituting other restrictions, different restrictions, they have different vaccination rates. They have different epidemiology. So, well, I guess my overriding message to educators and to parents and to students themselves is we'll do everything to keep you safe. And right now, with the plan we have today, we feel that keeps people safe.
Add to that, I think, you know, looking at that, our overall vaccination rates, but even knowing that if you go by age breakdown, the 35 and above have very high vaccination rates. So that's the vast majority of teachers are in that age cohort. So I don't think we have a huge amount of unvaccinated teachers out there. We're very good in terms of the 12 to 18-year-olds. It's the 20 to the 35-year-olds that are still doing well, but not as well as everybody else. So we always have to look at what we're doing and there's a principle in public health. You have the least intrusive measures necessary. So we've done very well in Nova Scotia by following an educative approach and supporting people to get vaccinated. As I said in my remarks, we'll continue to look at our vaccine coverage and look overall in terms of where we might need to have a policy-based approach to go to that last step, if you will, to make sure we have the highest possible vaccine coverage.
If we were at the 75% coverage right now, would these New Brunswick restrictions be mandated again and re-implemented today if we were at that August end goal of 75%?
So that's one factor, but the main factor that's driving adding additional restrictions for New Brunswick is the epidemiology in New Brunswick, and what we're seeing is that's been driven by unvaccinated people, and we're starting to now see, again, mostly in unvaccinated in Nova Scotia, but we're starting to see some cases in Nova Scotia and contacts in Nova Scotia linked directly back to New Brunswick. So we feel it's necessary to put that extra layer of protection, if you will, focused on people who are unvaccinated, that you can't just come freely into Nova Scotia. You need a period of quarantine. To me, that's very legitimate. Our whole goal is to keep Nova Scotians safe, and people who choose to be unvaccinated are going to have to go to extra measures to keep the rest of us safe.
Mr. Houston, yeah, it's congratulations, by the way. It's 6 days ago you won, but it's a bit unusual to see a Premier-designate essentially acting as the Premier in a sense. I'm just wondering if you could sort of walk us through how this came about today, that you're the one sitting in front of us and that we're having this news conference today with you telling us what you're going to do.
I think probably this is my first transition, so I'm not really sure. But I mean, I think probably every transition is a bit unique. So I will say that I was very sincere in the outreach to have an all-party committee to talk about COVID and where we go from here. There wasn't much uptake from the other parties. So. Look, Nova Scotians are anxious for the back-to-school plan. Nova Scotians are anxious to know what Phase 5 might look like and when that might happen. So here we are today communicating that to Nova Scotians.
Mr. Houston, you and Dr. Strang have both talked about how if this is going to work, people have to continue to follow public health guidelines, including staying home when they are sick. And one of the things that we heard throughout the pandemic is that for some people, they're quite literally making the decision between staying home when they're sick and whether or not they have enough money to pay rent. Where are you and your team on the question of paid sick days for everybody so that they don't have to make that decision?
Yeah, I mean, look, nobody wants people having to make those types of decisions, particularly not during a pandemic. So I understand the emotions of those decisions. But for me, it's I'm just getting up to speed on a number of files, and that would be one of them. But my position all along has been, to the extent that there is a need for paid sick days. That's a discussion that the province needs to have with the federal government. There's a role for the federal government in that. So there's a number of things that we'll be talking to the federal government about. Obviously, healthcare in general is something that I'm passionate about fixing, and there'll be a need for partnership at the federal level on that. There's a number of other things as well. So we have a lot of discussions to have with the federal government. That'd be one of the.
Some
For both of
jurisdictions.
you, but I'm just wondering if you, if we're moving this to phase 5, perhaps just in mid-September, do you expect the state of emergency will also be lifted around that time?
So I guess I'll go first, but the state of emergency has just being in a state of emergency has a number of implications. Obviously, it gives some authority around border controls. It gives some authority to make some public health decisions. There are other ramifications as well around different types of insurances and things like that. So it's one of the things that we're going to get a full briefing on exactly what the state of emergency means, and then we'll make some decisions on that. But my focus right now, today and over the last few days in working with Dr. Strang and his team has been on back to school. And we've had discussions with NSTU on the back to school, with the department on the back to school. So that's a primary focus, and also communicating phase 5. What would phase 5 means and when people could reasonably expect that to happen. Obviously, the New Brunswick border thing is something that's kind of came up over the last few days as well. So there's lots of issues around the pandemic management, and we're going to work closely with public health on all of them, including the removal of the state of emergency.
Have you discussed this plan with educators before announcing it today, or is this the first time they're hearing of it as well?
Yeah, so there's been constant discussions between the Department of Education, between the NSTU, and therefore educators and public health. There's a subcommittee that talks back and forth on these issues, and that committee has met somewhere in the range of 100 times, I think, is the most recent thing I heard. So it's been quite active. I mean, and I'm sure they probably don't agree on everything, but they've certainly had discussions, and elements of this plan are as a result of those discussions. So, and then last evening, the department, Dr. Strang, myself, had a conference call with NSTU just to talk about some of the higher level elements of the plan. So. I think that the bottom line is everyone is on the same page. And that is the page of making sure that schools are safe for students, that schools are safe for educators, and that families can have a high degree of confidence that the schools will be safe. And I think we've done well during the pandemic, and I think everyone is on that same page that this is a path to get us there.
There was a suggestion recently that some people who have appointments for a second dose way down the road, we're going to have those appointments canceled in an effort to get our vaccination rate up sooner. Did that actually happen? Were those appointments canceled and people forced to rebook?
Yeah, no, first of all, the canceling appointment is not, the purpose is not being to force people to move up. It's been, we've had community clinics, but, and the community clinics were necessary when we had large volumes of people getting immunized. We don't need those people anymore, so we've closed them down. And so because the clinics were closing down, those appointments were canceled. We certainly use that as an opportunity to say to people, your original appointment is canceled, please move it up, and here's why you need to move it up. We're doing the same with our pharmacies. We no longer, given the volume of people still required to be immunized, we don't need all of our pharmacies to be open all the time. We certainly have, and I thank the Pharmacy Association, they've worked very creatively. So I just use this example, I pick a community, Bridgewater. We know that the pharmacies there are going to work together, so there will always be 7 days a week at least one pharmacy that people in Bridgewater can go to, but we don't need need all of the pharmacies in Bridgewater open all the time, given the volume of people. So because of that, there's been some people with some pharmacy appointments have had their appointments canceled. And again, using the opportunity for them to say, rebook your appointment, and here's why you need to rebook it as early as possible. But I think it's important to understand that the primary reason of canceling the appointments was not to force people to move things up. It was because of operationally the amount of capacity we need now in these last phases of our vaccine program.
Dr. Strang, given that the school reopening will be among the largest gatherings we've seen in Nova Scotia in some time, why is just 1 week of mandatory mask wearing essential for getting back to school?
School's going back on Tuesday, the Tuesday or Wednesday. If things go well, we'll look at the 15th for phase 5. We've already talked about that. Certainly, that it would make sense to keep the masks on until the end of that week and make a transition over the weekend. The reason the schools have indicated the education system is they're pleased with having at least a couple of weeks of masking, because it sets the norm. Even if once we remove the mandatory requirement for masking, like we want people to wear masks in indoor public places, we encourage and would strongly recommend staff and students continue to wear masks. So starting off the year with the requirement of masking allows the school year to start with and recreating that norm around masking. The schools can do teaching, they're building it into the curriculum, and get kids and student and teachers kind of up to speed with all the protocols. So there's value in that. If for some reason our epidemiology changes, then we will relook at that. Or if we need to extend because we're not getting where we need with vaccines. But right now, once we get to that 75% target and our epidemiology remains where it's at, we're in a very low risk place here in Nova Scotia, and it would not, my perspective, it wouldn't be justified to have mandatory masking even in schools. But if either of those situations changes, I will come back and have more conversation with Mr. Houston, and we'll assess and say what's necessary to keep Nova Scotians safe.
So
Dr. Houston, we have about 17% of schools in Nova Scotia that rely on passive ventilation, so opening windows or doors in order to get that airflow. Are those schools going to be upgraded with active ventilation for this school year?
Ventilation is an ongoing discussion in terms of all capital projects around schools, and there's a number of them. But for purposes of COVID, I think I have a high degree of confidence that schools are safe, particularly with the masking for the first while we get to higher vaccination rates across the community. So that's an ongoing discussion, but there's no conclusion on that today.
You were asked a question about the state of emergency. And I'd be remiss if I didn't ask you about rent control. I know what your policy is on rent control, and you favor increased supply, but of course, building more supply takes time. And so when we look at the interim, what is your view on whether or not the current rent control that's in place should continue to be tied by the state of emergency, or do you foresee a scenario where it needs to be extended while that housing stock gets increased?
I don't see a scenario with extending that. That's not something that I've been focused on. I feel very sincerely that the solution to the housing crisis is more housing stock. I don't believe that rent control is a solution to the housing crisis. I have calls from people who have lost their rental because of rent control. Somebody just said, I'm not renting anymore because of that. So it's a complicated issue that requires a thoughtful solution. So what I would say to people is we're going to swear a cabinet in next week. And right away, the minister, the appropriate minister, and myself will meet with the Housing Commission too, the commission that studied this, and really get to work. We want to get to work. We understand the anxiety that people are under. We're totally sympathetic to some of the more dramatic situations we hear about. I mean, I don't want to give the impression that I'm not concerned about it. I think every Nova Scotian is concerned about it. But at the same time, we have to have real solutions. We have a housing crisis. We have to address it. And that's going to take some time.
The police involvement and use of force in the shelter evictions that took place last week?
Obviously, that was an HRM decision. I've spoken to the mayor to try to understand, how it got to that point, and there's the number of steps that had happened along the way. So I'll have further discussions with them, but I don't think anyone wants to see violence on either side. And law enforcement was doing their job. They were doing what they were asked to do. The bigger picture for me is, the bigger question for me is, how do we get to the point we have 10 cities in downtown Halifax? And we didn't have those 8 years ago. So how do we get there? How do we get to the real solutions on that? But as I say, the rent control, the housing crisis, all of these, particularly sad situations we're seeing, are going to require good policy going forward. And if I had a magic wand, I would have pulled it out last week and fixed it. But we just don't have it. But we have to address the root causes of these issues if we really want to move the province forward.
Dr. Strang, I know this is a politically charged conversation on the topic of what happened last week, but given that housing is a social determinant of health, and many health colleagues of yours spoke out against the police action that was taken last week, saying it was disproportionate and not in the best interest of health, where do you stand on that?
Well, I think we always have to look at understanding why people are homeless, and that we treat people in a compassionate, understanding way, and build in supports that we need a range of solutions to the housing crisis. Some of it's affordability, some of it's people with mental health addiction issues that we need to do a better job of supporting in the health and social supports, so they can be in appropriate types of housing. So as Mr. Houston said, this is complex, and there's no easy answers here. But hopefully we can always address this by understanding that there are people are there for a reason, and then how do we work with them to understand what are the solutions that are going to allow them to be in a safer place, that housing is a fundamental need for overall health.
Dr. Strang, you
Are
have
public health
jurisdictions
concerns about the use of pepper spray on a public street?
I'm not going to comment directly into kind of actions police took or did not take. I've not been involved in enough detail of either side to make any comment on that. But I would say that we need to step back and look at how we do things moving forward, understanding there's reasons why people are out on the street without any homes, and how do we work together to build solutions to understand that are going to work for people. And if people are saying the solutions that are given them are not going to work for them, then we need to understand what is going to work for them and work collectively across communities to try to get those solutions in place.
Strang, there are some jurisdictions.
One more.
There are some jurisdictions where kids who are 11, who are going into middle school, who are close to turning 12, are being allowed to be vaccinated before getting into school. Is that something that we're looking at here?
So that's an off-label use of the vaccine, right? It's licensed. It's not actually licensed by Health Canada for kids under 12. So that's a slippery slope. Those numbers are really small. As soon as kids reach 12, whether it's the day after school or in October, November, whatever, they become eligible for the vaccine, and we would encourage them to get their parents to get them vaccinated as soon as they turn 12.
Okay, now we'll move to the phones, and as a reminder, I will call on each outlet by name for one question. We'll rotate through the list in the time that allows, and then we'll return to the room for final questions, okay? Starting with Radio Canada, Adrian Blanc.
Thank you. Dr. Strang, you said you wanted to make sure that 75% of the population is fully vaccinated. Would a vaccine passport be a tool in the next weeks?
So I think that the term for me, vaccine passport, we're really trying to do, that's a federal government conversation about how does proof of vaccination go along with your actually real passport to facilitate and support international travel. What we're talking about is policies around people using proof of vaccination, whether they have access to a range of services, within Nova Scotia, and how that may play out domestically of traveling within the country. That what we're focused on in Nova Scotia. Nova Scotians currently have proof of vaccination, but it's a little bit cumbersome for them to get. They have to go to the website with their health card number and those things. So there's active work going on, and this is a federal-led conversation. We expect some movement in the next few weeks so people, Nova Scotians and other Canadians, can have a consistent format of proof of vaccination that's easily accessible, that then perhaps could be used, whether it's for international travel across the country, and even there may be some private organizations here in Nova Scotia, businesses that want to use that as well. What we're focused on is making sure people have ready access to that proof of vaccination, as well as encouraging every Nova Scotian who can get vaccinated to be vaccinated, and then they can use that proof of vaccination.
Next, we'll go to Truro News. Chelsea Gould. Go ahead, Chelsea.
Thank you. Dr. Strang, in the back-to-school plan, it states that absenteeism of 10% or a higher absent rate than expected will be reported to public health. Can you explain the reason for this measure and what public health would do with the information?
So that's not new. That's been a long-standing policy we've had in place for years. I've been here for 20 years, and it was here when I got here. It's simply that if schools are seeing a significant number of both students and staff, and we've chosen 10% as the cutoff, which seems to be from a common source. You know, they're getting lots of people phoning in first thing in the morning, and seems to be a bunch of similar illness. Well, we want public health to know about that, and then local public health will do some investigation to try to figure it out. With COVID, it becomes even more important, because what we want to do then is saying, okay, we have a bunch of people in a school which have COVID-like symptoms. Maybe we want to figure out how do we actually facilitate some testing to really try to understand what's going on in the school. But this is not new related to COVID. It's just COVID makes it even more important. And so we're actively working with the schools to make sure that the schools understand their responsibility and have protocols in place so they can collect that information, and if they hit that target, to make sure that they know how to timely contact local public health.
Next, we'll go to the Guysborough Journal. Lois Ann Dort. Go ahead, Lois.
Yes, hello. I'd like to ask, what opportunities are there for parents and guardians who don't want to send their children to school if masks are no longer mandatory in Phase 5?
And I'll take us. I mean, I think that like any reason why their parents may not want to have their children in school, I think having a conversation with the principal, school administration, and as appropriate, virtual learning or take-home learning arrangements could be made, with that, with that student. So, but I think really the conversation, the parents, the family with their school administration.
Now heading down to Liverpool, Ed Halverson at QCCR News. Go ahead, Ed.
Thank you. I'm wondering what conversations have been had regarding how you determine what services will be available to Nova Scotians based on their proof of vaccination, such as, students can be in school, but can I go into a restaurant or a retail outlet, and what can they ask of me as far as requiring proof of vaccination in order to allow me in there?
Yeah, go ahead. So I think we have to understand that, as government, public health is going to give advice, and we're looking at that as what is the role of government in that. There certainly is a space for a private organization or a business, as we're seeing now with some universities, to create their own vaccination policy. And if they choose, for reasons of whether it's workplace safety or creating a safe social environment for their customers, if they choose to have a vaccination policy, that they're able to do that. My message for the last number of weeks has been simply saying that make sure that you do your work, because there are legal, privacy, human rights issues that you need to be aware of as you're creating those policies. One of the key things is that you're not denying somebody that there are very small numbers of people, and I stress very small, who cannot get the COVID vaccine, and so those people, like other people with disabilities, they need to be accommodated. So you need to figure out how you're going to do that. So, but again, with that advice I give to people around making sure you look at this from all those contexts, there's certainly nothing that would stop a private business organization going down that road. And that's why we're focused on making sure Nova Scotians have a very easy access to a digital form of proof of vaccination, so they have that if they're asked for it.
And just Ed, thank you for the question. I mean, just in terms of the province is not contemplating anything along those lines. That advice was to private businesses. I think there was some talk towards the end of the campaign about a Scotia Pass concept. I think, Ed, that was maybe along the lines you're talking about, but that was not something that bubbled up from public health. So the province is contemplating phase 5 reopening with, restrictions removed. That's what we're contemplating right now. If that's the heart of your question, Ed, that's the answer.
Next, we'll move on to Six Rivers News. Bill Martin.
Thank you. My question for the Premier-designate. Of greater concern for some is the question of centralized decision-making in Nova Scotia Health. So notwithstanding the approach to COVID, will your government be looking at putting some authority back in the hands of local leaders who may in fact have a better feel or a better understanding of local needs and deficiencies?
Hey, Bill, thanks for the question. Yes, we will. We talked about that as, respecting local voices, respecting the knowledge of communities in education and in healthcare. So that's something that we're actively going to make sure that there's an appropriate mechanism where local voices have a say in what happens in their community.
Moving on, we'll go to CBC's Blair Rhodes.
Yes, I have a question for Dr. Strang. Today, the FDA gave full approval to the Pfizer vaccine. Up to now, all the vaccines have only been approved on an emergency basis. I'm wondering, does this in any way change the playing field here in Nova Scotia?
No, that's a dynamic of the regulatory approach and policies in the United States. We have both AstraZeneca and the 2 mRNA vaccines, Pfizer and Moderna, which have been fully approved and therefore licensed by Health Canada. So the FDA, that U.S. decision makes no change here in Nova Scotia or Canada.
Moving on to CTV, Suzette Beliveau.
Hi there. Just going back to looking ahead to phase 5. And I've just heard from many business owners around here looking at the exposure list and perhaps what it does to business for them when they see their name on there. So a lot of people wondering if those exposure lists will continue once we enter phase 5 and if that's something you're looking at keeping up.
Those are all like low-risk exposure, so that's absolutely one of the things we're actively looking at right now with public health about the need and value of those, also recognizing the impact it does on when you identify a place, a business. So under active discussion within public health, and we'll bring forward a recommendation.
Moving on to Tim Bousquet at the Examiner.
Yes. Hello. Dr. Strang, there was as I see it in phase 5 starts, there's going to be 2 tiers. Everyone living in Nova Scotia, no restrictions. The only restrictions on travelers. That misses a middling group, I think, that you imposed during the second outbreak, and that's household members of travelers who had to self-isolate. I'm thinking specifically of young school children of unvaccinated travelers who might be a vector back into the schools. Can you speak to that?
So in general, if people are coming in and they're unvaccinated, they have to quarantine. We have protocols in place. If they quarantine in a house with other people, they have to be isolated from those other people, have no close contact. It doesn't mean that they can come and just live with a family or family or friends here in close contact, because that's not isolation. So we have those protocols in place that people would be expected to follow if they're required, whether it's 7 or 14 days of isolation upon entry to Nova Scotia.
And finally on the list, we'll go to Kyle Shaw with the Coast. Kyle, are you there?
Sorry, I was just fiddling with my phone. Dr. Strang, I've got a question about breakthrough cases, actually. June 4th was the first date the province started reporting on it. And on June 4th, 0.6% of cases were of new COVID infections were among people who've been fully vaccinated. Last Friday, that number had nearly doubled to 1%. How much of a concern is this rate rising so quickly,
given that 1% is still such a tiny proportion of the total?
So as I've said from the very beginning when we talked about breakthrough cases, that the higher your percentage of your population that is vaccinated, the higher the percentage of the cases will be breakthrough cases. It's just simple math. If most people are fully vaccinated, then most of your cases are going to be fully vaccinated. But it still is only 1%. So the breakthrough issue is we're open and transparent about it. I think the take-home message is that vaccinations are not 100%, and so even if you are fully vaccinated, making the choice once we no longer mandate it, making the choice to follow the public health recommendations around masking in indoor places, hand washing, etc., remains important even if you're fully vaccinated, because your risk of being infected and transmitting to others is greatly reduced, but it's not down to zero.
Okay, we have a few more minutes. I'll go through the list, a couple more of the list anyway. Heading back to Radio Canada, Adrienne Blanc, do you have a follow-up?
Yes, Dr. Strang, how concerned are you by the fourth wave, and precisely will the epidemiology in Canada be taken into account when deciding to switch to phase 5?
So I think I am concerned about a fourth wave. It's clear, as I said in my remarks, it's clear we're entering the fourth wave, and some provinces are already being substantively impacted already. We will get the fourth wave here. And as I said, we will get some cases. We may get little clusters in unvaccinated population. How we minimize the impact of the fourth wave, it really is the key driver there is our vaccination rate. But it's also why we need to maintain those border restrictions that, entering here and whether you need quarantine or not is based on your vaccine status. We want everybody coming to Nova Scotia to be doubly vaccinated to help protect us of the introduction of the virus from other parts of Canada even, and that's how we keep ourselves as safe as possible through the fourth wave. The decision to make to go to the phase 5 is really based on our local epidemiology and where we are at with our Nova Scotia vaccination rates, because those are the key drivers about whether it's safe enough to open up. We've already made the decision that we're going to maintain our border measures at least, as we get through the fourth wave, as that layer of protection of the introduction of the virus into Nova Scotia.
Chelsea Gould, Toronto News, do you have a follow-up?
Yes, I do. Thank you. You stressed that it's important for those eligible to get vaccinated, Dr. Strang. For teens whose parents do not support them getting vaccinated, do you have any messages for them?
Well, first of all, that I hope there can be a conversation within that household. But at the end of the day, that we actually have long-standing, and this is across the country, that individuals who are judged to be mature minors by a healthcare provider, there's no specific age cutoff, but they have to be judged to be mature enough to be able to understand information, give their own informed consent. They are eligible to make their own choices about whether to receive health care, including whether to receive COVID vaccination or not.
Guysborough Journal, Lewis, do you have a question?
Yep, one follow-up, thank you. So I've talked about the entering into phase 5 as it pertains to vaccination rates. Is there a number of cases that would mean we wouldn't move to phase 5 even if we were 75% vaccinated?
No, I've always said the decisions around epidemiology are not based just on a case number. It's always the trends that we're seeing and the average number of cases, that we're seeing over time, the context of the cases. Right now, we're still very comfortable what we're seeing. There's no sign of community spread. It's travel or close contacts, and the number of contacts per case. So there's a number of things we look at, some of them number-driven, some of them more contextual, that we get from public health's follow-up of cases, and I talk with my MOHs on a regular basis, and they give me both the science and art of what they're seeing, and then we make assessments and then bring those forward for decision. So again, it's more than just a single number that would drive any kind of decision around epidemiology.
Okay, we're going to move the questioning back to the room.
Dr. Strang, can you clarify again the amount of testing required for New Brunswick and travelers from the rest of Canada for 1 dose and for no doses?
So if you're unvaccinated, you have to quarantine for 14 days period. We don't require testing, but we certainly highly recommend that people get at least a test at the beginning and a test at the end of their 14-day quarantine period, because we know that 14 days is a very sufficient period. If you're not sick at the end of that, then you're not you're not going to have COVID. If you have a single dose of vaccine, you have to isolate for a minimum of 7 days. And what we're saying is that you have to get a negative test before you can come out of that isolation period. So if you don't get a test, you have to continue to isolate even as day 8, 9, 10. So what we say, people get a test on day 5 or 6, and then if that test is negative, once you hit day 7 ends, then you can come out of that isolation.
Mr. Houston, I know you're still probably working on your cabinet picks, but there are 9 female PCMLAs to choose from. Can we expect to see some parity in this upcoming cabinet?
Yeah, I'm excited about the cabinet. We have quality MLAs elected all across this province, and we'll have a very, very capable cabinet for sure.
Mr. Houston, in 2019, you introduced a piece of legislation that would have made vaccines mandatory for kids as they go into school. Is that something that you are still interested in pursuing?
No, but back to Natasha, the answer to your question is yes. There will be a capable cabinet, and it will be representative for sure. That was a piece of legislation at the time that let's say we thought it was a good idea, and in hindsight we backed away from that once we learned a little more.
Mr. Houston, the PEI, as part of its back-to-school plan, has plans to hire some additional staff, teachers, support staff. Is that a consideration here, or will it happen here?
I think it's almost in the same line as the ventilation question, and just there's lots of discussions to be had around education and class sizes and making sure that students have the resources they need. We've committed to the inclusion report and making those changes and stuff. So there's lots of discussions to be had, but not specifically as a COVID response. I wouldn't say for the return to school. We're confident that the COVID response, as it's put forward, will make sure that everyone is safe, and there's no other elements contemplated as part of a COVID response, but there's lots of discussions to be had around education.
Mr. Houston mentioned earlier the Scotia Pass idea that was floated during the campaign. You'd kind of previously been averse to vaccine passports, or the idea of them saying it could lead to less vaccination. I'm wondering if your position has changed at all, or if you can elaborate on your position now on vaccine passports.
So my position, I think, has been consistent all along, is what I articulated earlier, that we're not looking at that in general as a government kind of initiative, but that individual businesses and organizations, as outlined to the answer to a previous question, have that capacity. But I've always advised them they need to look at legal, human rights, other issues if they choose to go down that road.
You said that, Mr. Houston, you said that you spoke with the mayor about how the city got to the point last week where folks were being evicted with police involvement. And then you said in that same sentence that obviously housing stock has been low, and that's likely led to that outcome. So what is the logic behind ending rent control before housing stock is actually increased?
Just my position on all the challenges that the province faces, and there are many. In healthcare, there are challenges in housing, there are challenges in rebuilding the economy. I think as a province, we can't convince ourselves that a couple sentences or a soundbite solve problems. We're more interested in actually getting to the root cause. So the solution to a housing crisis is more housing. We need more housing. That's the only way to solve a housing crisis. So I think there's lots of ramifications of rent control that are actually not productive to adding housing stock. So even the commission wasn't in favor of that. So I know that for some people it sounds nice and it's easy to say, it's just a few words, but most of the problems and challenges and opportunities that we have in this province can't be distilled down to just a few words. So for anyone who says that rent control is the solution to the housing crisis in this province, it's not. It's disingenuous to say that. So I won't say that because it's not the solution. So we really need more housing stock in this province. That's how we'll solve the housing crisis. Rent control is not the solution to the housing crisis in this province. It's just not. I'm sorry.
But respectfully though, sir, isn't it, if not the solution, isn't it the bridge? Because if you remove it before the stock that you acknowledge needs to be there is in place, where are people who are going to be priced out of their apartments? Where are they supposed to go if there aren't affordable, if there's not affordable sufficient housing in place on the market?
Well, I mean, if you institute rent control, what does that do to those that were thinking about building stock? So you have to, there's all kinds of moving parts to this, right? So what I want is more housing stock in this province, and we will take the steps to make sure that that happens. And we don't want to do something in the interim that gets us away from achieving the goal that we need to achieve. So, look, we're going to have discussions with the commission. We'll talk to not-for-profit groups. We'll talk to anyone who wants to talk to us with ideas and solutions about how we bridge, or what our long-term solutions. We'll have those discussions. We're anxious to have those discussions because nobody wants to see somebody homeless. Like, I don't want to see that. But at the same time, we have to make sure that we're making decisions for the long term. So we'll get there. We'll have discussions with anyone who wants to talk about solutions for bridging, to use your word, or whatever is necessary in the short term. Those are discussions we'll have. But I don't believe that rent control is a way to a long-term solution to the problem that we have here, and I think it could be a deterrent to a long-term solution.
We'll take one final question.
One final question. Short-term solutions that you're proposing to do kind of right away.
Yeah,
before winter sets in?
I'm hearing lots of ideas from lots of different sources. I mean, obviously hotel rooms are something that people talk about. So we'll have a thoughtful discussion with the different stakeholder groups and people who have ideas. So we understand there's an issue, and we're going to have some thoughtful ideas on how we address it.
That's all. Just on the issue of parity within the cabinet. So can we expect to see a fair number of women involved in this cabinet?
Yeah, the cabinet will be one that is equipped to address the challenges of this province. It will be capable people, and they'll be representative of the geography and gender of the province. Yeah.
That's all the time we have for questions. We'll turn it back to Mr. Houston for final remarks.
Thanks everyone for coming. So I know it's been a little while, but we'll make sure that we're accessible for all kinds of issues in lots of formats as we kind of get through the transition here. And to Nova Scotians, I know that I'm a new face here today to many of you, but fortunately I'm sitting next to a very familiar face whom you have come to trust in Dr. Strang, and I want you to rest assured that my government and I personally will continue to work closely with Dr. Strang and his team to protect the health and safety of Nova Scotians. That's our only goal, and we will do what is necessary to keep you and your family safe. And I will work hard to earn your trust over time. So thank you for tuning in. Thank you everyone for coming today.